if it's worth it or not worth it. We just got here, but they told me I do have a notification. What's up, you guys? So today is my surgery day for my eyes. My pre-op time would be at 7:30 in the morning, so I'm just getting all the essentials. So for the surgery, you have to bring those 3 eye drops that they wanted you to bring, and I did buy from Amazon this one after the surgery and this one, so that this one would be the eye protection. So let's go. We just got here at home. After surgery, we have to go get my script for a pain medicine, and the very first time I stepped out of that surgery, my eyes was just too watery, very watery. That's why it's hard for me to open my eyes. There was no pain, honestly. It's just like discomfort I am feeling, but the light sensitivity is super real. I actually bought this one from Amazon, and then the moment that I put it on, it's just the light sensitivity I can't bear. So good thing is that I did buy another eyeglasses, which is this one, but my eye clinic also gave me an eye protector. This eye protector is also nice, but it's not too dark like this one. This is the eye protector that they gave me. See, it's see-through as well. It's just like tinted compared to the one that I bought from Amazon. This one is much better because it's more darker and it has more style on it too. So that was my entire experience during the PRK. I can't tell so far if it's good, but I mean, I don't have any pain, which is a good sign. The procedure itself runs super fast. It took them for 15 minutes to finish the entire laser surgery procedure, and then after that they keep on telling me congratulations, and I said yes, but I was like, I don't know what's going on. Teary eyes, a lot of teary eyes, but I just said yes, thank you. They gave me Advil and also a first dose of a Ativan, 1 milligram. But then while I was in the VIP room, I was waiting for it. It seems like they asked me again if I needed more, and I was quite little anxious that I am about to go to the surgery. So they gave me another dose of Ativan, and for me that really helps a lot. It calms me down because the moment I stepped on that surgical chair and eye flat on my back, and then a lot of things that they're doing on my eyes. The good thing is that they're going to tell you what kind of procedure they're going to do before they're going to initiate it. They're going to explain it to you. Dr. DeCurdy, he is very professional when it comes to that. He trained his staff the way it should work, from step 1, step 2, step 3. He is very organized, to be honest. The entire procedure, they have put the clip on my eyes, and then after putting a clip, then that's the time that they keep on doing it. But prior to that, they keep on flushing my eyes with lots of numbing ointments. Yeah, it numbs my eyes. But you will be awake the entire time. You would know the steps of how they are doing it. You will see lights, always lights. You will see white lights, and then you will see a red light that is hanging in there, and in the midst of it, you will see a halo green light as well. And they wanted you to look at that, the green lights and the red lights. So it was a really good experience, to be honest. I was not able to bring my camera to vlog it. We're not really friends with the DLV Vision, and I'm too shy to ask them if, hey, I'm a vlogger, can I vlog my eye surgery journey? Let's just be realistic. Not everyone wanted to be in the camera, and not everyone is agreeable to it. So I just leave it. I try to bring my camera and take some videos in between. So that's why you don't really get to see a lot of these videos wherein you'll see me explaining the procedure. And also in the VIP room, I was able to take some videos while I was alone, but then people starting to go inside the VIP room and it's just too awkward to be filming it. DLV Vision also do some cataract surgery and all the eye surgeries that they're doing, but again, for my side, I'm doing the laser surgery. I was actually first rooting for a LASIK surgery that there's no downtime. Like once they're going to put the new flap on, you'll see everything 20/20 vision. But because of my case, my eyes morphology or the size of my eyes, especially the cornea, it's bulging. So it's not really a good fit to do the LASIKs. So they decided it's for the best interest. It's more safe if I have to go for the LASIK PRK eye surgery. So which I did it. The good thing is that I really have a good support system. My entire family, my sister, my dad, everyone. My sister keeps on calling me early in the morning saying, hey, this is your surgery day today, good luck. And my dad bring me to the clinic station. So what we're going today is that to reconcile all the medications that we have to do. I do have 3 droplets, and the first week would be very crucial. I have to be very compliant to my eye drops. It comes with steroid, it comes with a pain medicine, and it comes with an antibiotic. So the more compliant I am, the better would be my healing process. So right now, I do have a notification for my alarm that I have to do my second eye drop because they did the first eye drop in the surgery. I'm going to show you my journey, let me say, from using an eyeglasses vision, and in this way I would be able to explain to you and talk in front of the camera about these things. As I go along, it's going to be a 7-day journey, and as always, I'm going to bring you to this journey. Tomorrow, I'm scheduled to do a very first 1-day post-operative checkup. I'm going back to Westlake and see if how things are doing and remove the contact lens that they put in. The contact lens is just to protect my eyes. And then once that contact lens will be removed, I believe I would be able to get a much more brighter vision. So let me just do the eye drops. I'll come back and forth, popping up just to see you and just to report to you about what's going on. Any significant changes, mild significant changes, you will know. So if you are going for a LASIK surgery, at the end of this day, I will tell you my recommendation if it's worth it or not worth it. Okay, let's go.
Is a procedure where a first flap is created, which is a thin slice through the patient's cornea. As a second step of this procedure, the flap is reflected back and a different laser is used for actual refractive treatment. After that is done, the flap is replaced back and basically the procedure is done. Photorefractive keratectomy, or PRK, is very similar, but there is no creation of a flap involved. So it's a shorter procedure, but there is a difference in the recovery period with this procedure. LASIK recovery is much quicker. Patient experiences very good vision and minimal discomfort almost immediately, whereas with photorefractive keratectomy, or PRK, recovery could be a little bit longer and vision doesn't come in right away. It takes a few days.
So I do have my eye protectors here. This is the one that they gave me because I told them that I actually bought this one through Amazon, but then they said it's good, maybe I can try it, but once I'm going to sleep sideways it hurts for this tool, or if I'm going to sleep to the other side it does help, or that way you should be okay. But then they said this one works wonders. So the way that they're going to use it is that this one to the right eye. You just have to put this one in. See that? And then put the tape here and put the tape here. Right there. I think that would be better, I guess. And then this one right here, the same thing. Time check, it's 6:40 in the morning and I just finished my shower. Yes. So after this LASIK eye surgery, you can actually resume your normal activity as long as if you're going to have a shower, the shower does not go directly to your eyes. It would be better if it goes directly to your chest. And so far, it works great. Let's see as the days forward. Time check, it is 11:30 and then the clinic gave me this one. They told me this is how I should sleep. Good night and I'll see you tomorrow morning. Day 1 post-surgery. It's still blurry but it's better than yesterday after the surgery. And today we are going for our day 1 post-op in the clinic. I'll take you. Alright, so today it is our day 1 post-op and then we're going to see my optometrist and see how things are doing. Let's go. We're going for our day 1 post-op surgery. Let's go. It really feels good that you're not doing anything at all. Today is the day 1 post-operatively for my laser eye surgery. Again, I did do the PRK. So the PRK is different from the LASIK because the LASIK, there's no downtime. After your LASIK surgery, you will have the perfect 20/20 vision. But it's because of the shape of my cornea, I cannot do the LASIK. So the doctor decided that it's safe for me to do the PRK. That's why right now my healing process would be 1 week at least. So yesterday I did my surgery and today I did my first post-op visit. So far it was all checked good, everything's good, no signs and symptoms of infection. The most important thing after the PRK is that you have to make sure that you are religiously doing your eye drops. You will have 3 sets of eye drops 3 times a day and you have to make sure that you're actually protecting your eyes all the time. Day by day, according to the doctor, I will have a better vision. Like as always, I'm going to take you to this journey until we will achieve the 20/20 vision. If you have any questions, feel free to drop some comments and I will try to answer as much as I could all your questions. This is what I look like when I am sleeping. What's up you guys? Good morning. Very good news. It's day 2 for my post-surgery and it was super amazing because when I opened my eyes this morning, it was like a magic. I saw my TV completely clear. I saw that one right there on my wall art completely clear. It was surreal. It was like a magic to me when I saw it. And then I saw the letters very, very clear. I was like running around. I was like, wow, this is very clear because yesterday it was totally blurry. This is day 2 post-op from my surgery and I'm seeing it clear. How much more as the days goes by and I still have my contact lens, it's going to be very clear. But for day 2 after surgery, it's not bad to have a progress like this. At least I was able to see the clear vision, but then it fluctuates to right now. It got blurry again, but I mean, there's an advancement or there's a progress for day 2. So for day 2 surgery, this is not bad. And we'll see how it goes for day 3. Just an update. My vision, it gets very blurry. Let me show you what I'm looking at and how blurry my vision is. This is how blurry my vision. Yes, see that? That is so blurry. And that is what I am seeing right now. Yes. It's day 3 after surgery and it is still blurry. Yesterday it was very clear, but now it's still blurry. I can see it, but it's blurry. It seems like for one letter, I would see 2 to 3 letters. We'll see how it goes. It is day 4 after my surgery, and it's getting better. Yeah, I can see my writings right now. It's a lot better compared to yesterday, because yesterday it was just too blurry. Getting better, and it's getting clearer. It is nighttime. It's 11 p.m. This is how I patch my eyes. So, I'm going to show you. This is how I protect my eyes. Because sometimes if you're sleeping, I keep on moving. You wanted to protect your eyes. This is how I protect my eyes. Now, good night. It's day 5 post-surgery, and let's see. Day by day, I'm getting used to it now. That's the main reason of the eye protection, is that I cannot rub my eyes like that because of the protective. Right now, it's getting much clearer. It's still blurry, but day by day, it's getting a lot better. Hopefully, I will be able to work tomorrow, and that's going to be my day 6. And then after tomorrow, I'll go day 7 post-surgery, and that's the time that they're going to remove my badge. What's up, you guys? So it's day 6 of my post-op surgery, and let's see. I would say day by day it gets better and better, although there's still some blurriness. Sometimes you would see letters 3 or 4 angles. Now that it's on day 6, it's a lot clearer. Like right now, I can look at my credit card and I can read it better. On day 1, 2, and 3, I can't even read it even closer. I have to go look at like that in order for me to read it. And let's see how it goes for the entire day today, and let's see if it fluctuates or it doesn't. Good morning. Today is day 7. It's my 1 week after surgery, and I would say it's a lot better compared to previous days. I can see it, it's a lot better. However, because of the contact lens, it's a day 7 post-operative or 1 week post-op, and I'm going to see my doctor today, and finally they're going to remove the bandage, which is the contact lens, and we'll see if my vision would be much clearer or not. And then I think it's going to be a lot better because there's no more contact lens. So today we are going to our doctor's appointment with my eye doctor. Today is my 1 week post-surgery. They're going to remove my bandage, which is the contact lens. So I can't wait for that contact lens to be removed because it's very uncomfortable. Hopefully my vision would be a lot clearer once they're going to remove my contact lens. And as always, I'm going to take you to this journey. Let's go. I just finished my 1 week follow-up visit with my doctor. I am with my optometrist, and then she finally removed my contact lenses. OHPNT. I just got back home, so to make this story short, it's still blurry, but I would say it's progressing really well compared to day 1 post-surgery. The doctor told me that as the days goes by, I would be able to see the difference with my vision. But again, right now I'm okay, but day to day, hopefully it gets clearer. Thank you so much for joining and for watching me for this journey to 2020 vision. And if you like this video, click like, share, and subscribe. Thank you.